It's the appointed time and we have a quorum. I call the meeting to order. Item 1 on the agenda, information papers issued since the last meeting. The Secretariat issued 3 sets of information papers to members. They are referral from meeting between Legislative Council members and Taipo District Council members on the 31st of May 2024, and the referral from meeting between LegCo and Central and Western District Council members on the 31st of May 2024, and a letter from Mr. Adrian Ho. The Secretariat has referred the letter to the administration. Let's see how the administration reply before we take further action. Item 2 on the agenda, items for discussion at the next meeting. The administration has not updated the list of outstanding items for discussion. Let's wait and see if the administration has any new items to add before we decide on the items to be discussed at the next meeting. There being no objection, the date of the next regular meeting will be the 14th of October, Monday. That is after the summer recess. We will be having a meeting at 4:30 p.m. on the 14th of October. The items for discussion will be sent to members by the Secretariat when they are being informed by the administration. Item 3 on the agenda, Community Care Fund, LC paper number CB bracket 2973/2024 bracket 03. We have quite a number of government officials with us today. They are Mr. Chris Sun, Secretary for Labor and Welfare and Chairperson of the Community Care Fund Task Force. We also have from the Home and Youth Affairs Bureau, Mr. Nick Ao-Yun, Deputy Secretary. Also from the HYAB, Ms. Jody Hoon, Chief Executive Officer of the Community Care Fund. Dr. Frankie So, Consultant of the Health Bureau. Mr. Stephen Wong, a Project Director of the Housing Bureau. And Ms. Chen Lai Chu, Assistant Director of the SWD, and Ms. Anissa Ma from the SWD as well. And we also have Mr. Clement Chan, Senior Manager of the Hospital Authority. Mr. Sun, will you walk us through the paper, please? Thank you. Thank you, Chairman. We come to the panel once every 6 months. We came to the panel last December. 6 months have passed. We're coming to the panel to report on our progress. Since the establishment, the CCF Community Care Fund has endorsed 67 assistance programs as at the end of April this year. These CCF programs have benefited 2.85 million people. I think that we have achieved great results. The government has so far incorporated 25 CCF programs into its regular assistance service. Since the last meeting, we have endorsed some new programs. They are the Maintenance Mediation Pilot Scheme, and in To Kwa Wan, Hong Ham, and Nam Cheong, we have set up 3 community living rooms, and we have expanded the school-based after-school care service schemes. Last year, we had 50 schools, and this year we'll be having 100 primary schools under the program. Chairman of the CCF Fund, that is myself, has approved the introduction of new drugs and clinical indicators of existing drugs under the first phase program of medical assistance programs. We have introduced 4 new self-financed cancer drugs, and we have also added new clinical indications of existing drugs. On the ultra-expensive drugs program, we have introduced drugs for rare diseases. We have also added new clinical indications for the existing drug. 32 self-financed cancer drugs are now covered under the first phase program, and a total of 10 drugs are now covered under the ultra-expensive drug programs. For details, please refer to the paper submitted to the LegCo. I have with me a number of representatives from the policy bureaus and hospital authority. We are happy to take questions from members and chairmen. Thank you. Now is the time for questions. If you would like to speak, please press the request to speak button. I'll read out the names of the members who have pressed the button. They are Mr. Benson Look, Dr. Johnny Ng, Mr. Rock Chen, Ms. Jovi Chen, Dr. So Chen Wing, Mr. Chen Yong, and Mr. Vincent Cheng. 7 members have pressed the button. Each member will have 4 minutes, including question and answer. For the first round, Mr. Benson Look. Thank you, Chairman, and good afternoon, Secretary. In the Annex 13, 15, 16, 17, they're about community living room in Tokawan, Hongham, and Namcheon. The total expenditure is some $73 million. Hopefully, we can cater to some 1,000 subdivided unit households. I think that this community living room project are beneficial to people living in subdivided units. When Mr. Xia Baolong came to Hong Kong in 2021, he said that we should bid farewell to subdivided units. I understand that this term of the government attaches great importance to the challenges faced by subdivided units, and we have collaboration among the community, the business sector, and the government. This community living room project is a landmark project. The CCF provides funding and NGOs operates the project while the business sector offers a venue for the operation of CLR project. I have 2 points of concern. I think that the CLR has to be convenient. It should be within 15-minute walking distance from the subdivided units, and the CRL project are near Yaoqing district. According to our census, in 2021, there are some 26,000 subdivided units in Yaoqing district. So there is a high concentration of subdivided units in Yaoqing district, and we're looking forward to a CLR in the district. There is a study of having a CLR in the new reclamation market that has been abandoned. I wonder what the progress is about the study. So much for my questions. Secretary. Thank you, Mr. Look, for the question. I know that members are concerned about the progress of the CLR project. For CLR project, we rely on the collaboration among business sector, NGOs, and the government. For the venues, the business sector offer them, and the operation expenditure will be funded by the CCF. We have difficulties in identifying suitable venue for CLR. When we have identified a site, we will report to members. There are some people who have suggested private venues that we can be turned into CLR. However, there are restrictions and challenges that we'll have to overcome. Apart from Yaoqing, we have 3 CLR in 3 different districts. Apart from these 3 districts in the paper, there will also be CLRs in other districts. When we have more information available and when the sites are more confirmed, we will report to members. I think that the collaboration among business, community, and government is good. But I think that the government should not rely on the business sector offering venues for CLR. They should also consider their own venues or sites. Secretary, any response? We note Mr. Luke's comment. Thank you. Next, Dr. Johnny Ng. Thank you, Chairman. CCF has endorsed a number of projects and programs that benefit the members of the public. I support the assistance program set out in the paper. I'm glad to see the achievements that the government have made. Well, the available fund under CCF amounts to about $7.4 billion. How long can this amount last, and does the government have any plan to inject further funding into the CCF? That's my first question. My second question, now the CCF is placed as time deposits with the local banks. I think that this is a good move because we have high interest rate for time deposits currently. However, in the second half of the year, there may be interest rate reduction. And that is why, well, as a result, the returns generated may be lower. I put a similar question last year. The secretary said that if we place the CCF with the foreign reserve fund, then we cannot make use of them in a few years. I'll ask the Deputy Secretary, Mr. Nick Adrian, to address or take the questions. Thank you. The available fund under CCF amounts to $7.4 billion. That's the amount having net out the commitment for the assistance programs. So these $7.4 billion will be made to meet expenditure of new programs or any contingency. The CCF can be used till 2027, so there is not a need for us to inject any further funding into the CCF. We will keep in view the usage of the fund. If necessary, we will inject further funding. As for investment, Dr. Ng is correct. We used to place the fund under Hong Kong Monetary Authority, but there is restrictions. We have to place the fund there with the Hong Kong MA for at least 6 years. However, with our funding and expenditure needs, we cannot place the fund with the Hong Kong MA for 6 years, and that is why we withdrew the CCF from the Hong Kong MA and placed it as time deposits. Over the past few years, the returns generated from the time deposit was rather good. We will keep in view the trend of the interest rate. We looked into other investment venues previously. However, the stock prices can go up and down, and we have to be very careful. And no further questions. Next, Mr. Rock Chen. Thank you, Chairman. The CCF has endorsed a number of good programs and projects. I recognize the government's efforts in this area. For the pilot schemes, some of them are or have been regularized. So what criteria does the administration adopt to see if any programs can be regularized? That's my first question. Second, the CLR project is an excellent program. We now have 3 CLR, and the Secretary said that they will roll out more CLR in the future. For the new CLR to be established, will they be in districts where there are a lot of subdivided units? Will we be able to cover, say, half of the districts where there are a lot of subdivided units? The Secretary said that it's not easy for us to set up new CLR because it's difficult to identify new sites and venues for the CLR. Does the administration have any difficulties in identifying partners or operators, what challenges do you face in operation of CRR?
主席，多謝。
Thank you, Chairman. Thank you, Mr. Rock Chan. On the regularization of CCF programs. Well, after the rolling out of the pilot, we have to ensure that they are effective, and then we'll try to incorporate them into the regular program. But then, of course, it will be subject to the government's fiscal position. One example is that recently we have incorporated a program regarding the support for carers. Actually, there are 4 items. These are providing allowances for the carers. They proved to be successful. So for the last year, we have find the funding and incorporated them into the regular government program. For the community living room, I would like to thank Mr. Chen for your comments. You can see that quite a number of the CRLs are now in Sam Shui Po, Kowloon City, Hong Kong, and To Kwa Wan. So they belong to the Kowloon City district. This is an area with a concentration of subdivided households. And then also we have friends from the commercial sector who are able to identify premises for the CLR. We are now discussing with the relevant stakeholders. I can give you an idea of the districts to be covered by CLR. We will be covering Kwun Tong and Tsuen Wan. These are 2 districts with a lot of subdivided units, and there are people who are helpful and will be able to provide it with premises. The original design is that we think that a CLL has to be 2,000 square feet. If it is 4,000 square feet or above, then it is a flagship CLR. So the first one in Sam Shui Po is one such example. For To Kwa Wan, it is now running in pilot, and it is funded by the China Resources Company, and it is run by the Tonghua Hospital. So it is a very huge CRL of about 8,000 square feet. For the 2 coming in Kwun Tong and Tsuen Wan, they will also be mega-sized CLRs. The biggest challenge and the constraint are that we have a lot of stakeholders who are interested. Actually, we have sufficient funding under the CCF for the purpose, and we also have NGOs who are willing to run the CLRs. But the main challenge is the identification of premises. Very often, we come across people who said that they have premises, but for the government, we have to comply with some of the regulations, say like fire safety regulations. For some of the premises, they may not comply fully with the building regulations, and then we cannot take them on. And then the people, they are offering us with premises in the old buildings, but they may not be able to meet the current safety standards. So what I want to say is that there are a lot of people who have heart and would come to us to initiate the operation of a CLR, but it is difficult to find suitable premises. For Sam Shui Po, it's in an easy area because there's a lot of urban renewal programs. So the premises are more or less in order. So I hope that we can all work together. If you have come across suitable premises, please do let us know, and we'll try to create as many CLRs as possible. Well, I don't have a specific program, but we will try to construct more CLR in districts with a lot of subdivided units. Next, Ms. Jovi Chen, Deputy Chair. Well, actually, I'll be following up on the issue of the use of Chinese medicine. Actually, there are now 2 main types of medicine, which is used for addressing spinal muscular atrophy, SMA. In Hong Kong, we don't have a very systematic medical protection scheme, and we hope that we can cover it under the CCF. For the patients of SMA who are under 25 years old, they cannot use the 2 major types of medicine. Once they pass 25 years old, they have to shoulder the very expensive drug expenses. Well, for my organization, we have submitted a written question, but the experts group said that it is not suitable at this stage to fund the medicine for use by people who are above 25 years old. So I would like to know the reason why, and is there room for any changes? And also, since last November, we have an announcement that there are 2 new drugs for addressing cancer, and they are verbal medicine. Well, I know there are a lot of inquiries about these new drugs, but I'm given to understand that price is an issue. Even if they are approved to be used in Hong Kong, I hope they could be included in the safety net and see whether the CCF can tie in with this 1+1 medicine scheme. Well, I would like to ask Mr. Chen from the HA to respond to this question. Thank you for the questions. On the SMA patients, we understand that now there are 2 types of medicine for treating them, and it is internationally researched by the organizations. And we see that for the adult patients, the effect is quite good. So for the CCF experts, we will try to look at the situation and apply the medicine mostly to children because it is more prominent there. So that's why we try to apply the medicine there first. And the experts group thinks that it is not suitable at this stage to make use of the CCF program to cover expensive drugs for the adult patients. But then, of course, we will look at the latest development on medical research. The member has also pointed out that there is a 1+ mechanism. If there is a new drug that can pass through the 1+ mechanism, once they are included in the Hong Kong drug list, then they can also be incorporated into the subsidy scheme under the CCF. Well, for the inclusion of these drugs in the CCF assistance program, can we expedite the process? For the 1+ mechanism, can we do that quicker? Well, I think the process has been expedited in the past. It will take about 2 or more countries to have the drug recognized, and then it will be used by the HA. But now for the 1+ mechanism, if there is 1 country and also 1 expert in Hong Kong thinks that is suitable, it will be introduced into Hong Kong. So I think we're doing it quicker now. Next, Dr. So Chang-Wing. Thank you, Chairman. The paper have listed out the various CCF programs, and I think that they are very meaningful and they are very useful. And I would like to pay tribute to the Secretary. Well, today, one of the issues for discussion is the school-based after-school care service expanded program. I think this is a very meaningful program. I've heard from a number of quarters in the community that the parents and the school principals are all supportive of this expanded program, and they want to have more places to help the families in need. So the current expanded program has extended the number of service places, but I think we should be doing a bit more and review the number of service places. If there is the need from the citizens that cannot be met, I do hope that the CCF will be able to address that and increase the number of service places. I think the resources from the schools are readily available, and then if, as the Secretary has said, that there is sufficient fund under the CCF, I hope we can assign more for the purpose. Second, I note from the paper that in Togo Wan, Hong Kong, and Nam Chang, you are going to construct community living rooms there. Well, according to the paper, every year you'll be able to receive 190,000 visitors. If we divide that by 3, then and also divided by 365 days. So that means every day they just receive 173 visitors. Well, this is not a small number because I think we got to have activities for the CLR. and we have to have facilities and space for the children. They can do homework there and they can play there. So I would like to know what is the minimum standard. You talk about 2,000 square feet, and if you have to receive 173 visitors a day, that would not be a lot. Secretary, you just said that you will have larger CLR of even up to 8,000 square feet. So I would like to know for the CLR operating, are they very densely congested or are they appropriate for use by the users? Thank you, Dr. So. First, for the school-based after-school care service scheme, the expanded program, we have increased the number from 50 to 100 for the coming school year. So it is already expanded. But with the wish for the schools to participate, we'll be willing to see whether we can take in more schools. So this is the first expansion that we're going for. For the community living room, they will be in operation this summer. The biggest one will be in To Kwa Wan. That will be funded by the China Resources Company, and it is operated by the Tung Wan Hospital. It's almost 8,000 square feet in size. There's another one is in Hong Kong. That one will also be commencing operation this Thursday. And it is funded by Sino Corporation. It's the second one sponsored by them. For the one in Nam Chang is about 2,000 square feet. So I think the total number of square feet will be able to meet the demand. We try to make reference to the example in Sam Shui Po. Well, the operators are very good. They will try to accommodate as many visitors as possible. But the CLR are gradually coming into place, and we hope that by the end of the year, we will have even more community living rooms coming on stream. Next, Mr. Chen Yong. Thank you, Chair, and thank you, Secretary, and the government officials. I know from the community that for the community living rooms or the after-school care service, they have been very effective and they are able to help the users a lot. So we have received positive response, and I would like to commend you on that. Well, for the fiscal position, I think it's doing well. Well, up to the 2024 April, we have some $10.9 billion, and we also have funds available of around $7.4 billion. So we now have 510 primary schools in Hong Kong. 100 of them are being served by the after-school program. So would you consider further expanding the program so as to cover more schools, and it will help our young children develop and grow? For the community living room, it is within about 15 minutes walk from the subdivided units. I think in Sam Shui Po and Yau Chim Mong, there would be more community living rooms. I would like to know how you will go about the future development of CLR. Secretary, you have been working closely with the HYAB to help the grassroots and the young people. For the community care fund, although it's under different secretaries, but if you have the surplus, would you be able to collaborate with the other bureau? Because we want to care about our community after all. Can we have more targeted and more comprehensive services? And then you'll collaborate with the other bureau to make better use of the resources. Would it be possible to have further collaboration between your bureau and the SHYB under the leadership of the chief executive and the core teams?
Secretary. Now, regarding the school-based after-school care services scheme, we will expand it further in the future. The challenge that we have to overcome is that some schools are willing to participate, some are not. We want to further improve our service after expanding the program. As for the CRR project, we have a lot of such rooms in Kowloon, we need to have suitable sites and operators for us to establish CLR. We don't necessarily have to just have one CLR per district. I think the more the better, as long as we have sites available and interested parties to operate. Under the leadership of the Chief Executive, we try to implement various measures. For the school-based after-school care service scheme, we work with the Education Bureau. We're also happy to work with the care teams under the HYAB. With us today is also Deputy Secretary for Home and Youth Affairs. We want to help the care teams to better serve the community as well. Mr. Vincent Chang. Thank you, Chairman. I want to write on what Mr. Chang Yong said. If the CLR project operators and care teams can work together, that will have better service for the community. I thank the Secretary for his effort over the past 2 years. I have visited a number of CLRs in the past. I think that is very beneficial to young people and women who live in subdivided units, and especially with the hot weather these days, the subdivided units household could take a break at the CLRs. I think that maybe we can accord more functions to the CLR. The government will be combating the issues on subdivided units, and they have established a dedicated team to work on it. We have light public housing, transitional housing. I hope that as the community living room operators have good relationship with the subdivided units households, I hope that they can ask the subdivided unit households to move to light public housing and transitional housing to perhaps give them more information, because the vacancy of light public housing is still quite high. I think that by recommending these housing to subdivided unit households, then we can increase the turnover. Secretary, thank you, Mr. Vincent Chang. I work very closely with Mr. Chang on Sham Shui Po, for example. One of the functions of the CLR project is to disseminate important information. It's not just about transitional housing, light public housing. The CLR project operators also help subdivided units in terms of mental health and job-seeking information. I will talk to the operators to see how we can step up information dissemination. I agree with what Mr. Chang said. If the subdivided unit households can move to transitional housing, light public housing, then they can have their living conditions improved, and then their quotas in the CLR project can be allocated to other SDU households. We will work on that. Next, Ms. Lam So-wai. Thank you, Chairman. CCF has endorsed over 50 programs, and over 50 of them have been regularized since the inception of CCF. I wonder what the effectiveness of these regular programs are. I would like to talk about the school-based after-school care service program expanded scheme. There are over 50 schools that are using such service. For Shatin, Cheung Kong-o, Eastern and Southern districts, there are no schools under the scheme. Some people have told me that they need a school-based after-school care program because some NGOs do not offer after-school care service. So does the administration have any plan to further expand the scheme to other districts? Is there a time frame for the scheme? And will the CCF regularize the scheme? On the effectiveness of the work of CCF, does the administration have any plan to further inject funding into CCF to endorse other programs? Some persons with disabilities live in their own homes and they don't receive CSSA, but disability allowance. For some persons with disabilities, they may use electric wheelchairs and they need money to repair their wheels, and sometimes they have to clean their wounds and they have to spend thousands and tens of thousands of dollars on these items. Some persons with disabilities do not receive CSSA, and their medical expenditures are not sometimes covered under the disability allowance. So I wonder if the CCF can subsidize the persons with disabilities on these areas. Thank you. Secretary. Thank you. When will we regularize some of the programs? Well, as mentioned in the paper, as long as we think that the programs are effective, we will regularize them. But we also have to look at whether we have enough resources to regularize some of our programs. As for the school-based after-school care service scheme, we have over 50 primary schools under the scheme. They are concentrated in some districts. We will be expanding the number of schools to 100 from 50, and these 100 primary schools will span across all 18 districts. For Southeastern New Territories schools, we will be covering them as well. So please encourage the principals of these schools to participate in our scheme. Most of the money in the CCF comes from the government. We still have some balance of $7.4 billion. We think that the CCF can operate until 2027. We will see if we will inject additional funding at appropriate juncture, but that hinges on the overall plan of the entire government. As for the medical expenditure of persons with disabilities receiving disability allowance instead of CSSA, well, the CCF task force considers proposals submitted by respective government departments and bureaus. So if you have any suggestions, please let us know. We will see if we can endorse any such programs. CCF is very flexible. Next, Ms. Chan Ha-Yan. Thank you, Secretary and his team, for making good use of the CCF and for rolling out CLR project to benefit the underprivileged in Hong Kong. The Secretary said that we have $7.4 billion in the CCF and it can be used up to 2027. One of the major expenditure of CCF is the dental care subsidy for elderly. I wonder how the government decide to regularize any program. I attach a lot of importance to the oral health of the underprivileged. Since the 2nd of July, the surface scope of dental subsidy has been expanded to not just crowning, but scaling, X-ray examination, and so on. A lot more elderly persons can benefit. In the meeting last year, we talked about this as well. The dental care subsidy was rolled out in 2012 under the CCF. Although the government have been improving the services and we see results, I wonder when the government will regularize the program. In 2023, there were 5 programs that have been regularized. Substantial expenditure has been involved with the regularization. I think that instead maybe we can use the same money to establish new projects. For this, well, why is the government not regularizing the elderly dental assistance program? I'll ask Dr. So to take the question. Thank you. Thank you, Mr. Chan or Ms. Chan, for the question. For this elderly dental assistance program, last week we improved the program. The Health Bureau in 2022 established a working group on dental and oral health, and we published a midterm recommendations. We want to be prevention focused so that people can detect illnesses early. Before improvement of the program last week, elderly could only benefit from tooth or from dentures. Dispensing with the restrictions, we want to encourage elderly to detect their issues early and receive treatment in a timely manner. That's the recommendations put forward by the working group. At the end of the year, we will be publishing the final report. We'll also look at the effectiveness of the improved plan. Chairman, for this elderly dental assistance program, it was rolled out in 2012, so 12 years have passed, and this program's been funded by the CCF. I think that if you think that this program is necessary, you should regularize this program. There are still new programs that need to be funded under or by the CCF. Our elderly needs such service. I don't think that the program should continue to be funded by the CCF, and that's not fair for other programs. We should not continue to have the elderly dental assistance program funded by the CCF. We should have the Health Bureau subsidize or fund the program. Mr. Tankapio, I used to be a member of the Community Care Fund Task Force. I'm not a member of the panel. We have a lot of elderly persons in Hong Kong. There are some 700 to 800,000 elderly that could benefit from our programs. However, there are only some 20% of the elderly participating in the elderly dental assistance program. There are some elderly who are receiving living allowance who are not aware of such a elderly dental assistance program. I think maybe the government should remind all elderly persons that they're eligible for the program. They should notify the eligible elderly persons that there is such a program via emails or mail. 12 years has passed since the establishment of the program. Not all elderly persons are aware of such a scheme. I support also the CLR project. The 4 projects altogether involve expenditure of $100 million. In Kwaiting, we also have subdivided units. So when will we be having CLRs in all dating districts? In subdivided units, the temperature can be as high as 40 degrees in summer days. My last question. According to the table, some $3 billion are involved in the subsidy of drugs. Can we subsidize people to purchase drugs on the mainland? Maybe we can subsidize cross-boundary rehabilitation buses. Hospital authority staff say that for the same kind of cancer drugs, the drugs in Hong Kong are some 30 to 40% more expensive than the mainland. Maybe we can subsidize patients to see doctors on the mainland.
Secretary. Chairman, I'll try to respond to the question on CLR, and then I'll try to defer to colleagues from the team, for example, including the hospital authority. As I have said earlier, we work hard on the community living rooms, and there are a lot of people who have a heart to participate and help us in the scheme, and we will try to expedite action, and we will try to roll out the CLR as soon as possible, and there is sufficient funding from CCF to fund more CLRs. For the question on the elderly dental assistance program, I will defer to Dr. So from the hospital authority. Thank you, Chair. We now have about 730,000 elderly people who are receiving the OALA. Before the enhancement, this item only covered the provision of dentures. But we noticed from the report in 2011 that for this age group, not all the elderly people require dentures. And we noticed that only about 25% of them need dentures. So now we have about 200,000 applicants, and for those who have the need for dentures have already been taken care of. Well, last week we rolled out the enhancement. The enhancement is to enable elderly people who do not need dentures to apply for assistance under this CCF program. So we hope that we'll be able to benefit more elderly under this pilot program. The member for the first round question left is only me. I'm concerned about the first item, the first phase program about the subsidy for drugs. I noticed that there are about 25,000 people who have benefited from the program, and the cost is about $3 billion. My question is actually similar to the one raised by Mr. Tan Ka-Biu. Since he doesn't have sufficient time, so his questions have not been fully taken by the administration. I would like to know for the ultra-expensive drugs. They may be available in neighboring cities like Shenzhen and Zhuhai, and they may be approved for use by the 3A hospitals in the mainland, but the cost will be much cheaper. If we have another mechanism to enable the eligible patients to cross the border and receive drug treatment from the mainland, we will be able to save a lot of expenses. Of course, this is a big agenda item and the HA has to look into it. But if we only focus on the ultra-expensive drugs, they are very expensive and we have to use billions of dollars every decade. So if the patients are willing to go across the border, would it be possible to enable them to be treated in the mainland cities? Would the administration look into this? I would like to respond to the chairman and the question raised by Mr. Tang. For the mainland and Hong Kong, when we try to procure drugs and medical devices, we have different arrangements because of the one country and two systems arrangements. We have different legislative requirements, and also we have different customs territories. So for the import of drugs, there are different considerations as well. For the hospital authority, it has been liaising with the various stakeholders and to consider the various factors. As Mr. Tang has pointed out earlier, whether it is possible to have cross-boundary rehab buses, we can also try to look into that. The chairman has asked whether some of the ultra-expensive drugs can they be introduced to Hong Kong earlier to purchase them quicker. Well, for the 1+ mechanism, under that, we believe it will expedite the introduction of drugs to Hong Kong. Through this channel, we'll be able to liaise with the pharmacies. If the drugs may be cheaper in the mainland, we'll see whether it is possible to take into account the advice of the local experts and see whether we can incorporate these drugs under the CCF programs. We can look into all these suggestions. Well, sorry, I don't quite understand your point about the 1+ mechanism. Well, we have mentioned earlier that for the treatment of uncommon diseases or disorders in Hong Kong involves ultra-expensive drugs, and we have to see whether these drugs are introduced into Hong Kong for use. In the past, we need to have the registration of these drugs in 2 countries before they can be introduced into Hong Kong. But under the 1+ mechanism, if only one country, say the mainland or overseas country, or if the expert groups in Hong Kong are confident about the use of these drugs, then they can be introduced into Hong Kong for use. So the cost of these drugs may be lowered as a result. And we may incorporate them into the CCF program, and it will also reduce the expenses for us. Well, the first round of questions have been completed. Do members have another round of questions to raise? If not, then I will conclude the discussion of this item and move on. The next item is about the safeguarding of intangible cultural heritage. May I invite the relevant government officials to come in? For this agenda item, the government officials include Mr. Raisin Lau, the Undersecretary for Culture, Sports and Tourism, Ms. Yandy Chen, PAS of the Culture, Sports and Tourism Bureau, Ms. Eve Tam, Deputy Director of Culture, and also Ms. Joyce Ho, Head of the ICH Office. Welcome. May I ask the Deputy Secretary to introduce the paper? The administration attached a lot of importance to the safeguarding of ICH. In April, we have enhanced the proposal of safeguarding the ICH, and the paper has included Presidency's directions about the protection of ICH. He wants us to enhance the safeguarding of ICH and then also the Chinese culture. And we hope that we can pass that on from generation to generation. So that means we have to attach a lot of importance to safeguarding ICH work. The administration has attached a lot of importance to the preservation and safeguarding of ICH, and we follow in line with the policies of the mainland government. And we want to preserve, promote, and also enhance the passing on of ICH, and also enhance the public understanding of ICH and the public participation in ICH. This 8th of June is the National Day for promoting ICH, and we have been liaising with the MOTC to try to enhance protection of the safeguarding, we also have an exhibition in the Samtong Museum under the ICH Center. We have asked the ICH bearers and the craftsmen to have demonstrations of ICH so that people will understand about the ICH situation in Hong Kong and in the mainland and enhance their awareness. We now have 480 ICH inventory lists, and we also have 20 items under representative list, and 12 of them are listed in the national list of ICH. Chinese Cantonese operator has even included as a World ICH item. To further enhance the safeguarding of ICH, we have since 2019 enhanced the ICH funding scheme. The LCXD ICH office has stage exhibitions and also a series of community activities and educational activities so that the ICH can go into the community and schools. Also, we try to enhance collaboration with the mainland in order to promote culture exchange. ICH is a very important resource and will help enhance tourism. The ICH will liaise closely with the tourism sector so as to enhance ICH in tourism. Also, we would enhance publicity through various government departments. We will try to enhance the publicity of ICH protection, and also we will promote Hong Kong ICH items to overseas countries. We will liaise with local organizations and make use of the community resources and network so as to have comprehensive activities so that the ICH items can be passed on from generation to generation and also enhance the Chinese culture. Now I will ask Ms. Joyce Ho to give a brief introduction of the latest developments regarding the safeguarding and promotion of ICH, and we'll be happy to take members' questions. So it is time for questions. Sorry, Chairman, there is a PowerPoint presentation. Ms. Ho? The UNESCO has adopted a convention for the safeguarding of ICH, and it is applied to Hong Kong since 2006. And then the government has stepped up education and work regarding ICH. We published the first list of ICH inventory in the June of 2014, and it has 480 items. Some of them requires urgent protection. 12 of them have also been listed in the national list of ICH, and the Cantonese opera has been included in the UNESCO ICH list. In recent years, we have been trying to step up education in ICH protection. For the facilities, in 2016, we have set up the ICH Center inside Samtong Museum, and it has had a revamp and an exhibition, and it has now been reopened to the public. For the new exhibitions, it is entitled Lost and Found Exhibition Series. There are 3 series about Hong Kong festivals and traditional craftsmen, the ordinary or extraordinary, and then also covers some 40 ICH items. We also liaise with the ICH Hub, and we have set up in the CLP Group headquarters in Ho Man Tin. And this ICH Hub targeted at the youngsters. For the protection and promotion of ICH, one of the major measures is that we have established a funding scheme. Since 2018, we have set aside $300 million for the purpose to encourage community participation and protection of ICH. Since 2019, we have 2 major projects, the community drive projects and also the partnership projects. And we also have 5 rounds of applications. We have 157 subsidized items, and the funding is about $130 million. The activities are very varied. We have education promotion and public programs. We have transmission training programs, research and publication, as well as traditional festivals. We also try to have public programs like the Fun in ICH series, the Meet the Master series, and also the ICH Fun Days. And the ministry at the mainland has established the 8th of June as a National ICH Day. So we try to also promote program for the ICH for All program targeted at the disability people. We also promote Nanyin Performance Program. We have the ICH domain. We have lectures and workshops for the teachers. For the school programs, we have School and Culture Day Scheme. We also cover programs for these primary school students. For schools, we want to bring the ICH into them. We have the ICH Mobile Center, and we also have the Mobile ICH. We target at the primary school students. We have a picture book series, and we also have a puppetry shows. And we also have exhibition prints for schools. And we also target at the tertiary students. It's a program called the Thinking Beyond ICH program and ICH Creative Leaders. We also have exhibitions in the community by the end of this year. In Shatin, we will have a cultural heritage in the museum. And every 2 years, we will also have a program in the Central Library called Roots and Genesis. To tie in with the urban renewal New Year carnivals, in the first quarter of this year, we have established, like in the various community premises like the Changquan, we have tried to introduce the ICH items as well.
內地舉辦多個嘅展覽。
We have organized exhibitions in Guangzhou, Nanning, Beijing, Wuhan, and Shanghai. Last year, we worked with different cities under the Greater Bay Area. We organized a number of exhibitions and exchange activities. We also organized a IHCH exhibition in Bangkok. Transmission courses is one of our focus. We have organized a number of courses covering different ICH items, including Guantai making techniques, Nanyin unicorn dances, Hong Kong Chensan making technique, paper crafting technique, and Hakka Pisho dance. On research and publication over the past 1 year, we have conducted a study and published a publication. We have published 7 publications so far, and there will be more in the future. And we also have a Hong Kong ICH database that lists out the research data of the 480 researches that we have. In terms of representative items of the national ICH, in 2022, ICH Office commenced the self-evaluation and assessment of 12 protection organizations of national ICH items in Hong Kong. And the National Ministry of Culture and Tourism announced the assessment results in 2023. And we also act in accordance with the instructions put by the National Ministry. And we have remarkable examinations or examples of good safeguarding practice. And our Tai Fire Dragon Dance is one of the examples. The government have been encouraging the community to take part in conservation of ICH, and we work with different ICH bearers organizations, academic and non-governmental organizations. We work with them to conserve ICH items in Hong Kong. Through different channels, we promote ICH to the community so that they know more about what ICH we have. We make use of online media, paper media, banners on transportations. We also work with different bodies to promote ICH in Hong Kong. Thank you. It's time for questions. I'll read out the names of the members who have pressed the button. They are Professor Lau Chi-pang, Chan Ho-yan, Lam So-wai, Vincent Chang, Kenneth Fogg, Ma Fong-kwok, Kenneth Lau, and Yu Pak-leun. 8 members in total. First, Professor Lau Chi-pang, 4 minutes, including question and answer. Thank you, Chairman. I thank the CSTB for proposing this item. The item is very clear. It's about safeguarding and promoting ICH. Much of the content been set out in the PowerPoint slides. I'll just put my question directly. Our ICH are very much relevant to those in Guangdong province and the Greater Bay Area cities. Guangdong provincial government proposes 2 directions that perhaps we can follow. First, on the transmission of ICH, is mentioned in the paper as well. We have to subsidize ICH bearer organizations, and we also have transmission courses to nurture ICH bearers who are adults. In Guangdong, they focus on seed projects. They want to nurture young people and children to promote ICH. I have to declare interest. I have been promoting a project under the Jockey Club and the Hong Kong APA. This project is to promote ICH in schools. We used to work with junior secondary schools, and now we are also working with senior secondary school students. I wonder if the administration has a long-term seed project to promote ICH in primary schools or junior secondary schools so that students become more interested in ICH. We should not just be displaying the ICHs in Hong Kong, we have to industrialize it. Is it possible for us to industrialize the ICH items that we have? We have a lot of ICH items that are edible, that can be toyed with, for example. Can we accord labels to our local restaurants so that we know that such restaurants are offering food that are ICH items? That brings me to my 3rd question. Director Mr. Xia Baolong said that we should develop this concept of tourism is everywhere. We have this Sam Tung Ok Museum, which is an ICH hub. The size of this hub is rather small. We cannot really compare to the one in Guangdong. Can we establish a boundless ICH hub in Hong Kong so that we can have this concept of ICHs everywhere in Hong Kong? Maybe we can start from the urban area, say Wan Chai or Tsim Sha Tsui. We should label the ICH that we have and link them up and form a journey or itinerary for tourists to promote our ICH. Undersecretary, thank you. For the long-term seed project, we want to also introduce that. As mentioned, we have ICH at school and ICH at community. However, we also have to look at our resources. Over the long run, we will try to introduce ICH to school students. We will work with other cities under the Greater Bay Area to see how we can further collaborate. Because as mentioned by the professor, we and other cities in the Greater Bay Area share the common root, and that is why there's commonalities among our ICH. We'll see how we can share resources to better promote our ICH. On industrialization of ICH items, we are working on that. We are training young people to see if they can make use of ICH IP and turn them into products so that they appeal to members of the public. After establishing the Commission on Creatives and Culture, Well, ICH IP promotion will be one of the things that the Commission will work on. On this concept of tourism is everywhere in Hong Kong, I agree with the professor's suggestion. There are characteristics to different ICH in different districts. We have, say, Taihan Fire Dragon Dance in Tin Hao, for example. We can link the ICH items up and turn them into an itinerary or offer an in-depth tourism package to our tourists. We'll talk to different districts to see how we can work on it. Next, Ms. Jovi Chan. Please set aside some time for the government officials to answer your question. Thank you, Chairman. I am a member of the ICH Advisory Board. I know that the administration has been promoting ICH at schools, so I commend them for their work. So how do we promote ICH in Hong Kong? Apart from conserving ICH items, regardless of whether they're food or handicrafts, I think that we should also preserve persons who are skillful or these ICH bearers. If the ICH bearers cannot pass on their skills, then our next generation would not be able to learn about the handicrafts or their skills. By recording the skills in writing will not be able to really allow us to pass on or transmit the ICH. In Foshan, there is a national list, national item of ICH, which is a kind of paper craft on making lion heads. I wonder if we can learn from the National Ministry by setting up a list of ICH bearers. We should list out the names of the ICH bearers. Apart from the papercraft skills that I witnessed in Foshan, they also have a kind of massage. And they will have a list of ICH bearers, and they will set out in the list which generation the ICH bearer belongs to. I think in terms of industrialization of ICH items, in Foshan, they turn a village in Foshan into an experiential village. When you enter the village, they show a lot of different displays of ICH items, and they also offer fee charging courses for you to experience their ICH. I think that the government can learn from the experience of our mainland cities on the promotion of ICH. Thank you, Ms. Chen, for the question. We completely agree that we have to have ICH bearers for us to conserve the item, because ICH could be a rituals, could be a practice. The meaning of preserving ICH is that there are actually people who are practicing or conducting the rituals. We don't want our ICH to become an artifacts in museums. That is why we have been promoting ICH bearers. I agree with the suggestion that we should allow people to experience ICH. However, the Samtong Ok Museum is rather small. It's very difficult for us to offer experience sessions for people to try out the ICH. I hope that in the future we will have more venues to offer experience to people it would be best if we can have ICH bearers to teach these skills.
基本上係答咗。
Well, I think the Undersecretary has covered most of the question, and we agree with Ms. Chan's questions. We'll try to follow the criteria published by the mainland authorities and follow them. Next, Ms. Lam Shou-Wai. On the promotion and safeguarding of ICH, I agree with what Mr. Professor Lau has pointed out. We should have ICH everywhere. Well, as a Hakka person, we have the Hakka culture. That is the unicorn dance. And then also there is the making of the lion heads for lion dance. So for the villages in our 18 districts, I think there would be some special culture, and they can be spread around all the districts and not just confined in New Territories area. In Suncheon, for example, it is being done that way. I always go to Shantung myself, and the mainland has some first-class ICH. In Shantung, there is a lot of famous porcelain, and there is a porcelain museum there. And there is the back porcelain, which is very famous, and they are being used for national feast. So I want to know whether it is possible to have an exhibition of these porcelain items in Hong Kong. Also, can there be collaboration program and activities so that we can enable the renowned masters from the mainland to come to us and run workshops for our young people? In Shantung, they are also famous for kites. There is an area called Wai Huang, which is famous for the purpose, and every year they will have an activity that is international. They have a kite festival every year. I wonder whether it is possible to introduce these art pieces to Hong Kong. And then every year, a lot of cities in the mainland have their own activities. I want to know whether we can, for example, have the Hakka culture in Hong Kong with the glutinous rice desserts. So we should not be just confined to Tao Kulang, where Ms. Chen Yutming is based, but we can have these activities in all the 18 districts of Hong Kong so that our young people will become aware of the culture of the various villages, like the Hakka and then also the other clans. This is a possible way to transmit the culture. Undersecretary said that there will be exhibitions in the malls on ICH, but I hope that you will not just confine to exhibition panels. Well, the exhibition panels will help, but can you have more lively activities? Can you try to integrate with the communities? Can you go to the private housing estates, liaise with the real estate developers, see whether we can have more lively activities so that the younger generation will be aware of the various items within the Chinese culture. And let's start with the Hakka culture, please. Undersecretary. Well, thank you, Ms. Lam, for your questions. We agree with you. As Professor Lau and Ms. Chen has pointed out, ICH should go into the community. So in this respect, we'll try to see how to liaise with the various districts and collaborate with them in future. It is the same as tourism. People want to have more in-depth experience now. They want to go to the different districts and learn more about the district in great depth. So we will try to study the issue with the districts. It is also mentioned that whether it is possible to introduce some of the ICH items from the various provinces in the mainland. We have been doing that. Actually, we have received 2 delegations from the mainland, and they are willing to collaborate with Hong Kong. And they also appreciate that we have exhibitions hosted in the various provinces in Hong Kong and showcase the ICH items to them. Over the years, we have also introduce some of the ICH items from the mainland to Hong Kong. So we all both want to work more in this respect. So the short answer is that we're happy to do it, but we have about some 34 provinces in the mainland, and we have to cover them one by one. And it is not possible to have one collaboration activity with each province a year, because otherwise there will be too many such activities. But we are also stepping up collaboration with the various provinces. In Chengdu, we have collaborated with them before, and they say that it has attracted a lot of visitors to the Hong Kong ICH item showcase there. Next, Mr. Vincent Chang. Thank you, Chairman. I appreciate the ICH work done by the CSTB and the LCSD. We have been promoting our unique culture to other people. Well, a lot of colleagues have pointed out that we want to do more. We hope that there will be ICH everywhere. Yesterday, I was in the Yau Ma Tei police station. Every time I pass it, I see a lot of people there. Well, it is very hot, but there is a crowd there. Well, I've been thinking if it is possible to promote herbal tea outside the Yau Ma Tei police station, because it is so hot. So I hope there will be more linkages between the various ICH items. We collaborate with the academia, the other organizations, but I hope we can introduce some commercial element to ICH promotion. Well, you've have funding for the tourism sector. You encourage them to promote more ICH items. Well, recently we've been trying to promote the tourist spots in Sam Shui Po. For example, would it be possible to perform Cantonese opera there in that district? And then also whether it is possible to have herbal tea sold there as well. So I appreciate the work you have done, but for the coming stage, I hope that you will collaborate with more sectors, especially the commercial one. Do you need a government response? A quick response, please. Undersecretary, well, I fully agree with Mr. Zhang's suggestion, and we want to conduct more work in this aspect. We have a lot of interesting ICH items, like our dim sum, like our herbal tea, and also the Hong Kong style milk tea. All these are very interesting items, and we will proactively liaise with the stakeholders to see how we can introduce these elements into our tourism industry, and also facilitate our visitors to learn about these ICH items. So we would do more in this respect. Next, Mr. Kenneth Fogg. Thank you, Chairman. First of all, I would like to appreciate the administration's work regarding the safeguarding of ICH. Well, I can see from the PowerPoint presentation that they have done a lot. Today, we want to focus on safeguarding and promoting ICH. I want to talk about promotion. I think there are 3 levels. For the basic level, I think we should promote them in Hong Kong locally. Another tier is then how we can tell a good ICH story. For example, in the mainland, Undersecretary has talked about the exhibitions in Chengdu, and they are well received. But I think for the most important tier, is to how to make use of the national ICH. Maybe let's focus on GD. We're now talking about the Greater Bay Area. Can we try to make use of the ICH in Guangdong and tell a good Hong Kong story overseas? So apart from local ICH items, let's work on the Guangdong ICH items, and we can play the role of a super connectivity again. Well, I think we haven't done much in this respect. So can we do more? Can we liaise more with the ICH offices in the mainland and have greater collaboration? We also talk about industrialization of ICH. Last week, I have conducted an activity on ICH. We had invited the government officials from Guangdong over. One special point is that they emphasize a lot on industrialization. They look at the traditional issues, and they try to introduce an industrialization element in order to create a market. This is one example that I want to show to you. This is the elements of old Chinese architecture buildings built into these utensils. This is the work of a student. I thought it is from a professional designer, but actually it is from a student. This is very well received, and they collaborate with the museums overseas. So this is one way to tell a good story. So they try to promote ICH through design. I know from paragraph 24 that you liaise with the various communities, organizations. Can you liaise with the Hong Kong TDC or the Hong Kong Design Center to work more and try to commercialize these ICH items? For the last question on paragraph 12 of the paper, it is mentioned that there is the mobile ICH. My colleague has visited these ICH. They are actually vans, and you try to have ICH exhibitions inside them, so you can only accommodate a small number of audience. So since 2022, what is the cost for running this, and have you evaluated the effectiveness of this mobile ICH? How many schools have you covered through the mobile ICH? So how can we make it better? Undersecretary. On promotion, I would ask my colleague from ICHO to elaborate. We liaise with the Greater Bay Area cities every year, and I think we'll be doing more on that. On industrialization, I've said that we have set up the Cultural and Creative Industry Development Agency. And one of the major work is to how to present our creative items as industry items, and that includes ICH IP as well. So we will step up work on this front in future. On paragraph 12, collaboration with the mainland, I will defer to the ICHO. Ms. Ho, thank you, Mr. Fogg, for your suggestions. For the ICH Mobile, it comes into operation since 2022, and that was the COVID period. But until the middle of this year, we have covered over 100 schools, and 30,000 students have been covered. And you can see that if the vehicle is not at schools, we will try to park it close to the cultural locations, so that the ordinary citizens can also see the exhibitions on the vehicle. Well, during the weekends, they can also come up to the mobile ICH to look at the exhibition and have interactive activities. But if the mobile vehicle goes into the schools, we have more activities for the school children and give them more experiences. Mr. Kenneth Lau. Thank you, Chairman. In the past, the government has continuously tried to promote ICH to the members of the public. You have Public Education Day, and you also have training programs for the transmission of ICH items. You have included the making of Changshan. You have covered the unicorn dance, and you have also covered paper crafting instructions. ICH should be transmitted continuously. I would like to know, for the ICH bearers, is there an aging problem for them? And then also for the training programs, is it possible to train enough successors? If not, would you provide incentives to increase the number of ICH bearers and their successors, so that ICH can continue? The second question about the ICH promotion and economic development, it is pointed out that the ICHO will liaise with various government departments and will also liaise with the tourism sector so as to promote ICH to the overseas visitors, like our festivals and the gel festivals, like the various gel festivals. So can we do more on the promotion work and don't let these sort of special festivals cannot be transmitted. Can we encourage more visitors to enjoy these special festivals? So in future, will there be new ICH items that can collaborate with commercial development so that we can enhance economic benefits, so that the other sector will contribute to ICH transmission?
Undersecretary, I will take the second part of the question first. We are promoting ICH and trying to turn them into tourism spots and offer experience to our tourism. For this Cheng Chao Jiao Festival, it has become a very popular event. A lot of visitors and tourists go to Cheng Chao to experience the Jiao Festival. As for Tai Hang Fire Dragon Dance, we are turning it into a kind of festival in Hong Kong to appeal to more tourists. We're working on it, and we will continue to work with the industry and the stakeholders. We hope that they can offer us some packages or itineraries so that it's easier and more convenient for the tourists to experience the ICH items and festivals that we have. I'll ask the ICH office to supplement. Well, we have some transmission courses, and we ask the course organizers to engage students and young people. We see that a lot of young people participated in the transmission courses, and we have more and more young successors. Anything to add? If not, Mr. Yu Pak-lan. Thank you, Chairman. Chairman, ICH is our invaluable tourism asset and is one of the key elements for the integration of culture and tourism. We have a number of successful examples. We have Chen Chao Jiao Festival and Tai Hang Fire Dragon Dance. All these showcase the uniqueness of our city. In paragraph 27 of the paper, it is said that the ICH office liaises with various departments and work with the industry sector to promote ICH items and festive events. I think that the ICH office should step up their effort in this area. Apart from going to these festive events at particular dates or time, I think that we should allow our tourists to have in-depth experience with our ICH items. In Foshan, if you want to watch fire dance or fire dragon dance, you can just visit a temple at a particular time and you can watch it every day if you want. So I wonder if the administration have a plan to make it more convenient for the tourists to watch these festive events or performances. I have also a suggestion. We should link heritage with ICH. By that, we can provide in-depth experience for tourists. For Tai Hang Fire Dragon Dance, there is a center next to it to promote the culture of fire dragon dance. I think that the government should take a step further. We will have a Lopan temple become ICH item. So is there a mechanism for us to offer experience or experiential sessions for our tourists so that they can try to, say, set up bamboo theaters apart from offering these sessions, I think that we should showcase these ICH items by offering a center next to the Lopan Museum. Thank you. Undersecretary. At our cultural clusters, apart from museums and libraries, we want to also offer experience for tourists so that they get a taste of our ICH items. As mentioned, the Samtook Museum is rather small. We don't have much space for us to offer such experience to our visitors or tourists. Mr. Yu's suggestion is very good. We will work with the AMO to see if we can work on that. We're trying to collaborate with different parties to promote ICH. As mentioned, we have made use of the CLP's headquarters and turn it into an exhibition hall, and we also organize a number of exhibitions. We'll try to work with other parties and companies to promote our ICH items. We will also work with the tourism industry. We want to have more collaborations. We'll try to foster closer ties with the tourism industry. Next, Ms. Chen Yutming. Thank you. I speak in support of the government's efforts in promoting and safeguarding in ICH in Hong Kong. First, I want to ask about the ICH funding scheme. However, there's no mention of the effectiveness of the funding scheme in the paper. The funding scheme has been in place for some 5 years. Some 157 projects have been subsidized. How many people have benefited from the scheme? Well, the Tin Hao Jiao Festival is one of the ICH items that we have. But I never knew that the government actually subsidized the item. A lot of ICH items are located in the new territories, so I wonder if the administration will further promote the ICH items in the new territories. The government have been promoting the development of the tourism industry. ICH is a very important tourism element. Tourists come to Hong Kong to try our herbal tea, for example, and they take a lot of pictures. How can we better leverage the ICH items that we have to improve the tourism resources that we have? Undersecretary, thank you. As mentioned, we have a number of festive events that are ICH items. We will continue to promote them so that more tourists can experience local rituals and festive events. We can always do better, and we will continue to work on the promotion of these festive events. And we will also communicate with the industry. And for new territories, we organized a lift golf event in the new territories, and we went to see the golf course. That is, we also looked at the clans there, and we will try to promote our ICH items. But there's always room for improvement, and we will try to do better. Thank you. The ICH funding schemes have funded some 157 projects. Some are still ongoing because some projects last more than 1 year. The total participants amount to some 300,000. And we have 200 publications, including online database, that are funded by the scheme. We think that the funding scheme is very effective and has encouraged a lot of academic and community organizations to transmit ICH items and promote them. Any follow-up questions? No? Next, Mr. Chen Yong. Thank you, Chairman, and thank you, Undersecretary. As at August 2017, we have promulgated over 100 ICH items. I think that this will foster integration of culture and tourism. And this is in line with what Mr. Zhang Li, our Chief Executive, said. For my sector, CCPC, a lot of actually members like to enjoy cuisine. Under the UNESCO, for the top 10 as at 2003, they have a number of rankings. For Switzerland, South Korea, and Chengdu in the mainland ranked among the top 10 in terms of cuisine. For Macau, Jiangsu, Huai'an, they also have a lot of cuisines. No one would object to the fact that we are an international gastronomic center and we are a food paradise. I think that we should promote our foods and cuisine, and I think that we should step up promotion. Mr. Zhang Li led a delegation to Sichuan, and this will drive a panda economy in Hong Kong. They asked some mainland people in Sichuan, and they asked if they know that we have 4 pandas, and they said that they didn't know that we have or will have 4 pandas. That means that we have not made full use of the assets that we have. We used to our economy used to be very good, so we didn't have to really promote everything that we have, but I think that at these days we have to further promote it. I wonder when we will start promoting the fact that we are an international food paradise and apply for recognition under the UNESCO. Undersecretary, thank you. Our cuisine and food are internationally renowned. When you go to other countries, our Cantonese and Hong Kong style cuisine are very popular. We are looking into when we can gain recognition by the UNESCO for our cuisine. We've started working on it. We don't have a timetable yet, and when we have it, we will announce it. Chairman, despite the positive feedback, I hope that the administration will start applying to the UNESCO for the title of being a food paradise. And we also should turn ourselves into a panda city, and we should start working on it as soon as possible. It's my turn. Last month, I went to the Guangdong province and I participated in a duty visit. We went to Guangzhou for our last stop and we visited a museum. That was a museum clusters, including a art museum, cultural museum, and an ICH museum. These 3 museums are very different, but they form a cluster. The scale of the cluster is very significant. For the ICH Museum there, it's of some 70,000 square feet. It showcases a lot of ICH items in Guangzhou or Guangdong. And they offer some experience sessions for tourists on some 20 items. That's exactly what Mr. Yu Paklan was saying. And I also agree that we should have ICH everywhere in Hong Kong. But if we can have a center that showcases the ICH items that we have, that would be better. I know that the administration has been working on the promotion and safeguarding of ICH, as the central authorities have been attaching more and more importance to ICH. On the 23rd of July, the ISO approved the establishment of a technical group on the conservation of ICH. That's about evaluation, preservation, and technical matters of ICH, and they set the standards for such technical assessment and conservation. And they also set up their secretariat in Beijing. ICO sees benefits of having their secretariat in the mainland. This, I think, has to do with the fact that our country is a country with a lot of ICH items. So I have a question for the administration. Should we participate in the standard setting so that we can showcase our ICH items? If we can participate in the standard settings, we will be able to gain a lot of invaluable experience. So I wonder if the administration have any plan in this area. Thank you.
多謝主席。
Thank you, Chairman. First, about the facilities for experiencing ICH. As I have said earlier, we hope that when we try to plan the major cultural activities, for example, in the Northern Metropolis, we hope that we can try to introduce more elements for experience ICH there. As the Chairman has pointed out, we don't have sufficient space for the purpose at the moment, so that there cannot be large-scale regular activities, but we hope that there will be more space for that in future. On collaboration with the mainland, we have been liaising with the MOCT. We have a close collaboration with them. From time to time, the officials and the experts of both sides have a lot of exchanges. And during this forum, we will try to explore with the MOCT how Hong Kong can contribute more and how we can try to help promote and preserve ICH. We will be happy to explore that with the mainland authorities. We'll see what more role Hong Kong can play. A follow-up question. For the Hong Kong SAR, we now have the ITIB, and we liaise with them on the preservation of culture. But for ICH, what is your counterpart? Is it a liaison between the MOCT and the LCSD? Yes, we have direct liaison between the MOCT and the LCSD. So we will follow up with the MOCT to enhance collaboration between two. It is under the auspices of my bureau. Any further question from members? If not, Then I will conclude discussion on this item, and we'll move on to the last agenda item, AOB. We haven't received any AOB items, so I would conclude the meeting. The next meeting will be held on the 14th of October. Thank you, members.